All right, so let's talk health now. A sunken chest wall, or pectus excavatum, is more common than you may realize, and USA Health is the only hospital using cryoneuroablation in the treatment for the condition here in the region. Doctors tell me this isn't something that's discussed much due to patients being embarrassed about it, but if your child has a chest wall abnormality where their breastbone sinks back into their chest, you should definitely talk to their pediatrician about it. It may be solely cosmetic, but even that can cause anxiety and socialization problems for children. Worst case scenario, it can lead to serious cardiac issues. It's typically seen in children, particularly boys. It's often noticeable shortly after birth, but worsens during puberty. That's about the time when Lane Frazier says he started noticing changes in his chest. He tells me he didn't think much of it then, but when he got to high school, his doctors performed several tests and said something had to be done.
My heart had moved away from its original spot and moved to the left because it started caving in so bad.
Lane says he started experiencing breathlessness.
It was a little hard to breathe than normal, but as you've grown up, you never notice it because your body just get used to it over time. But the worse it got, the more it started. You could tell that I was having pains.
His chest wall had sunken to the point where it was close to hitting his backbone. That caused his heart to shift in his chest, and doctors say the problem could have led to heart failure if not corrected. The traditional procedure used to correct the damage is known to be painful with a prolonged recovery period.
This is typically traditionally be one of the most painful procedures that a pediatric surgeon does because it entails reconstruction of the entire chest.
But with the addition of the cutting-edge cryoneuroablation pain control method at USA Health, Frazier was able to have the surgery and finish high school the following month.
We use a technology that came out of some work being done for heart surgery, and it allows us to use a very cold temperature probe to freeze the nerves that provide sensation to the area where we're operating. And so essentially what happens is it numbs that whole area, and that numbing lasts for somewhere between 3 to 6 months. The before and the after in terms of what patients go through is really outstandingly different.
Dr. Hannah Alamayu says innovation like this is what being a pediatric surgeon is all about.
When you become a pediatric surgeon, one of the driving forces behind that is that you can change outcomes not just for a child and not just in that moment, but for their whole lifetime.
As for Lane, he's feeling much better these days. He will have to have a second surgery in a few years to remove the bar placed under his breastplate during his initial surgery. After that, he should be able to continue being a teenager without breathing difficulties, without embarrassment, and without pain in his chest. So glad Lane is doing better. And I'm told this operation is easier to perform during the teenage years rather than waiting until adulthood, primarily because bones are softer and more pliable during that time.